The number one reason people who need chiropractic care don't get it, the fear of the unknown. They don't know what's going to happen. They worry that it's going to hurt, and so they just keep living in pain. I made this video specifically to fix that. I'm Dr. Dustin at the Connect Chiropractic in Ames, Iowa. By the end of this video, you're going to know exactly what happens at your first chiropractic visit. We're going to run it down step by step, so there's nothing to be nervous about. All right, let's go. The first thing that happens when you come in is we talk. Before anything or anybody even touches, does any exam, no poking, no prodding, we want to hear your story. Tell a little bit about where you've been, about yourself, what you love to do, about your pattern. How long has this been going on? What does the pain feel like? Is it sharp? Is it dull? We want to be specific. Every symptom tells us a little bit more of what's going on. Is there anything that you've tried that makes it better? What have you tried that makes it worse? Has there been any imaging done? Any x-rays in the past, maybe an MRI? Have you tried other treatments? The conversation typically takes 15 to 20 minutes, and it's probably the most important part of our visit. The history tells us more than any single test could ever do. I'm listening not just for the obvious symptoms, right? The pain points, but patterns that tell me what's actually driving the problem long term. This is something that didn't happen just overnight. You were never rushed through this step because of how important it is. We allocated this time for you because we believe your story matters. After the consultation, you'll meet with me, the doctor, the case manager. We'll move into the physical exam. We'll do some different orthopedic exams, figure out what structures are involved. This is comprehensive. Can check neurological, can check orthopedic, can check movement, posture, not just poking around in sore spots. That's what the rookies do. We assess the posture, the stress points, because how your body is holding itself tells me a lot about what's happening structurally. We assess the range of motion, right? How far can you bend in every direction, whether it's rotation, different things are going to tell us different stories. We'll run these orthopedic tests and stress-specific structures to identify which ones are involved. And we do basic neurological screening, okay? Testing reflexes, different sensation, dermatomes. This is going to help with checking muscle strength, assess whether the nervous system is being compromised. All of this takes place with you in a comfortable position. Comfortable clothing, you come in, we can test in whatever you wear. There's no need to change into a gown, anything like that. You'll be guided through every exam where we explain exactly what's going on. Every test I'm running tells me something specific. Many of our new patients need these. I want to be clear about why. X-rays really show me the actual structure of the spine, the alignment of the vertebra, the height of the disc spaces, and the presence of any degenerative change in the curves in the spine. You can't see these things on a physical exam, and they directly influence your care plan and how long this is going to take to fix, both in terms of which segments to address and what technique and force levels to use. X-rays are not appropriate for every patient though, right? Pregnant women, for example, or patients with certain conditions that may not need them initially. But for when they're indicated and when we know structurally something deeper is happening, they make our care much more accurate and the recommendations more specific so you can get better faster and more efficiently. After the exam and we show you your x-rays, I want to sit down with you, go over everything that we found, show you directly what the spots are that we need to fix. You'll even take a picture with your phone. You can show your friends, your family, anybody else that you consult with your healthcare. This is also when I make my recommendations. I'll explain what type of care I think would benefit you, how frequently I'd like to see you, and what a realistic timeline looks like for your specific condition. You'll understand why behind every recommendation before you ever agree to anything. There's never pressure to commit to a long-term plan before we've established that care is working for you. I believe in earning your trust through the results first. If you choose to begin care the same day, which many patients do, your first adjustment happens right after the report of findings. An adjustment is very specific, a controlled, applied force to the restricted spinal joints. We look to restore its normal motion, so we'll position you right on the table, sometimes lying on your side, sometimes face down, sometimes seated. It just depends on what we're adjusting specifically for you. As chiropractors, we utilize our hands in specific contact and applying a quick, low amplitude thrust that helps restore that motion to the joints. For most people, the immediate sensation is a sense of release. It's like a deep exhale for the joint. Some feel significant relief right away. Others feel a little more aware of the area 24 to 48 hours as the surrounding tissues adapt and restore motion. Both are completely normal responses. The force is always appropriate to the patient in front of us. Okay, treating a 70-year-old with osteoporosis is of course going to look completely different than treating a 25-year-old athlete. We use instrument-assisted techniques. We use drop table techniques. And we also use no thrust, very low force approaches when indicated. Let's talk about the pop or the crack that almost everybody wants to know about, if they got it or if you got it. Look, the sound is just a cavitation, and inside every joint in the spine is a capsule. Okay, it's filled with synovial fluid, and dissolved in that fluid are gases, mostly nitrogen and carbon dioxide. When the joint is quickly gapped during the adjustment, the capsule volume increases rapidly, and dissolved gas comes out of solution and forms a bubble. And that pop is the sound of the gas release. It's the same thing that happens when you crack your knuckles. No bones are cracking, no damage is happening. It's just physics and anatomy. Just as importantly, the adjustment is just as effective whether it makes a sound or not. Many of our techniques produce no sound at all. But after your first adjustment, keep moving, light activity, short walks, normal daily activities, all these help. The joints maintain the motion we just restored. The worst thing you could absolutely do is go home and stay still all day. The worst thing you can do is go home and sit all day long. Some patients feel wonderful immediately. Some feel a little sore after being adjusted for about 24 to 48 hours. Both are completely normal. Ice is a good source that can be applied to some sore areas. 15 minutes, never directly on the skin. Most patients see 3 to 4 visits before they have clear sense of how we're going to be responding. I'll be evaluating your progress at every visit and adjusting the approach based on what I'm seeing. I hope this removed some of the mystery around what chiropractic visits look like. There's nothing scary here at the Connect Chiropractic. Just thorough, honest, evidence-based care. And if you or a loved one are in the Ames area and ready to schedule your first visit, we are located right here at 1110 Buckeye Avenue. You can schedule online, theconnectchiro.com, or call or text 515-934-8267. Someone is always ready to respond. New patients are welcome, and walk-ins are always accepted. Look, if you found this valuable, Please subscribe to use this channel for weekly health education. We will see you in the next one.